This segment is brought to you by Greenville Dermatology. Trust your skin to the best.
Okay, heads up. Got some important information for you. Dr. Matthew Miller is with us we've had him last week, but he came back because we've got pictures. It's called TV. Board-certified dermatologist Dr. Matthew Miller. Welcome, Doc.
Glad to be here.
You brought pictures because a lot of us don't know when a mole becomes a skin cancer. Tell me this. What are the different types of skin cancers?
Well, there's two major types of skin cancer. There's melanoma, which is the skin cancer that can kill you, and then there's non-melanoma skin cancer. Luckily, the non-melanoma skin cancer is 10 times more common than melanoma, so it's not as severe. But we have pictures of both types of skin cancer.
All right, we're going to show those.
And so this will kind of help us determine what we should be looking out for. What's the first one you have here?
The first one is a normal mole, I believe.
Okay, all right. And if people are wondering the difference between a normal mole and skin cancer, can you tell us the difference?
Well, a normal mole is perfectly round and symmetric, and it has a well-defined border. It's usually all one color. But skin cancer is different than that. It can be an open sore that appears on your body. It can be a little reddish patch that doesn't want to heal. Sometimes it can be a little bump.
It's on his nose.
And so is this skin cancer we're looking at on the gentleman's nose?
This is a picture of a non-melanoma skin cancer,
okay,
a basal cell.
But it still is.
And they're normally,
wow.
Symmetrical is a good sign of non-cancerous.
No, symmetrical is a sign of a normal mole on your skin.
Just a mole, right, right, gotcha.
Okay.
Okay. And as we thumb on through the pictures, I know, well, first of all, tell me, there's some big words in this. Basal cell carcinoma, and then there's a different one.
Squamous cell carcinoma.
Squamous cell.
What's
what is
the
the
difference
difference between those?
The difference between squamous cell and basal cell skin cancer has to do with the cell it comes from.
Okay.
Squamous cell carcinomas are usually a little bit more aggressive, but not as common as a basal cell.
So let's run through. We had open sore.
Right. An open sore that doesn't want to heal. It's just constantly there. A reddish patch, again on the skin, which we saw a photo of that. A shiny bump or a growth that's changing.
Okay. Wow. What about pink growth, scar-like area, or any of those?
Those are also could be signs of skin cancer. So what I tell my patients is anything that's changing, that's wasn't there before on your skin.
So these are carcinomas. I mean, these are cancers, right? What we're seeing
yes,
now,
sir.
the pink splotch.
This is a picture of a basal cell.
Okay. And then the previous one. Okay, because we're getting our, with high def, we see things a little bit later, but we're seeing a sequence from that man's eyebrow splotch.
Right.
Through this one. Let's see if there's one after this. All right, so these are all actually moles that have turned.
So these are all non-melanoma skin cancers.
Right. Now, the only way to distinguish melanoma from the non-melanoma is, I'm assuming, through a doctor. Is that correct, or can you visually kind of tell?
You can suspect if you're not a doctor.
You can suspect.
It's okay to do that.
Right.
But melanomas are usually darker in color.
Okay.
They have pigment associated with them, whereas a basal cell or squamous cell may not have that pigment.
You know what I want to know? For those who have not had just a complete exam, and how often do we need to get checked by a dermatologist? And then what is that process like if people are intimidated at home?
If you haven't had a skin cancer, I think everybody should be seen at least once a year for a full skin exam. Once you've had a skin cancer, you're more at risk for getting new skin cancer, so you should be seen more frequently, maybe every 3 months to 6 months.
But before that, what is the frequency?
Once a year.
Once a year, okay. At a certain age?
Probably from age 20, 25 and above.
Okay. See, I think some folks in their 20s don't ever think about that.
Right.
And
we diagnose, melanomas in 20-year-olds all the time.
Is it as simple as the doctor just looks you from head to toe and?
Pretty much so. For some of the moles, we might look a little closer. We have little instruments that we can magnify those lesions and
Okay.
look a
You
little
can send off a
closer.
biopsy.
And then we
you might have
biopsy
it
if we're
out, right?
suspicious of a mole.
Okay.
Well, now with basal cell carcinoma, which carcinoma is the least of the aggressive cancers, or
Yes, sir.
the mildest, can't you treat those sometimes with creams or ointments? That's not necessarily a removal.
There are some creams that are approved for that, but for the most part, the cure rate is pretty low. It's
Okay.
less than 90%.
Okay. Now,
I should say that the AAD actually recommends you getting vitamin D. Okay, so
Right.
so if you'll stick around, our next guest is going to talk to us about getting some vitamin D.
Okay.
But we really appreciate you showing us the pictures, because
Okay.
last week when you were here, I think we started asking you more questions than you could answer with
Well, we had
just
to have him back.
description. Thank you so much for coming back.
You're
Thanks,
welcome.
Doc.
We appreciate that.